So typically the winter months are the busiest for flu cases, but at Connecticut Children's, the numbers are down drastically. Joining us now to talk about this is Dr. John Brancato. He is the Associate Director of Emergency Medicine at Connecticut Children's. Doctor, thank you so much for being with us.
Happy to be here. Thanks.
So what comes to my mind is we are all wearing masks, something we haven't done before. Is that the reason we're seeing a drop in cases, or are there other things at play?
I think that has to be one of the biggest reasons for sure. Masks, social distancing. Many kids across the state are either doing all virtual schooling or some kind of hybrid model. They're not participating in after-school activities and coming in much less contact with each other. It's a startling drop, I'd say.
I'm curious to find out, how does this year differ from last year in terms of the number of flu cases Connecticut Children's has seen?
It's amazing. It's absolutely the complete opposite from last year. So we normally have a pretty significant rise in our volume in the emergency department through the winter months for a variety of reasons, not just flu, respiratory viruses as well, of course, and then among the backdrop of other cases that we see year-round. A year ago, we had our busiest day ever in our emergency department with a day where we saw 293 kids in our department in a 24-hour period. And certainly not all of them were flu, but a significant percentage were. This year, we have not had a single positive flu test at Connecticut Children's.
That is just amazing. Not a single positive test. Wow. Obviously, it's winter. There's other illnesses out there. We're talking strep throat, bronchitis, pneumonia. Are you seeing similar drops with those viruses and illnesses?
Absolutely. Very little strep with an occasional, but much less than normal. We don't see a lot of actual bacterial bronchitis in children. That's more a disease of older people. But we do see something called bronchiolitis caused by respiratory syncytial virus. And we've had a big drop in cases of bronchiolitis this year and less pneumonia as well.
Well, a silver lining of this pandemic. Dr. John Brancato, thank you so much for being with us. We appreciate it.
My pleasure.